Alright, I'm Jonathan Sanchez, and this is PG, and we're going to be doing a complete physical assessment. Initially, when I walk in, I'm going to be looking for just visually assessing the patient, or the victim, as you would say. This is Rima. Um, be looking at his nutritional status, the way he's sitting, if he's comfortable, um, skin color, skin tone, and all that. And we're going to begin here. We're going to begin by palpating the head, okay, and checking his scalp for any tenderness or any possible discoloration in the scalp and stuff like that. Go all the way around, part of your hair, making sure scalp is even. Okay, and now we're gonna go ahead and while we're here, palpate the temporal arteries. Good pulses there. While we're here, we're gonna go ahead and check the ears, the helix, tragus, the mastoid. Okay. Now we're gonna go to light touch. You would just close your eyes and tell me if you feel this and if you feel the same. Tell me if you feel it. Okay. Does it feel about the same?
Yeah.
Okay. Alright. We're gonna go ahead and sinus and tenderness. And tenderness. Okay. Okay. Now we're gonna go ahead and do we're gonna check the eyes. Okay. Um we're gonna go through 6 positions. Just follow my finger. Without moving your head, of course. Okay. One more time. Alright. Now look straight ahead at me. Looking for the corneal reflex, make sure it's pupils are dilating or constricting in this case. And consensual response. Okay. We would also be looking for the red light reflex, make sure it's in the same spot in both eyes. I currently don't have the ophthalmoscope, so I wouldn't be using that, but if I did, we're gonna use the otoscope in place just to demonstrate how it would be done, how I would look at the macula. Okay, so I would come, find the red light on his eye, then I would come in and follow it into his eye, look for one of his arteries, and follow that artery back to the macula and look for any dullness or any other abnormalities. I'll do that to both eyes and look for those things. Okay. I'm gonna go ahead and we're gonna palpate for lacrimal glands. Check for any swelling, tenderness there. And do you have any? Okay. All right. Next, we're gonna go ahead and look into the ears. Okay. And the ear canal looks clear. The eardrum is intact, shiny, silvery. And we'll do that to both ears. And then I'm going to go ahead and check his nose while I'm here. Put your head up. Okay. And his mucous membranes in his nose look good. Pink. Good circulation. Alright, next, if I did have the tuning forks also, because I'm missing those, I would use those to check his hearing. I would use a tuning fork, tap it, set it on top of his head, symmetrical, and ask him to let me know whenever he can't hear anymore, and if it's equal, and if he loses sound in one first over the other. And then the Rhine or the Rene test, you would again tap it, place it on the mastoid, back here, place it on the mastoid, ask the patient to let me know whenever he cannot hear anymore, and then we'll bring it in front of the ear. And that's the Rhine or the Rene test, I would say. Okay, next we could go ahead and look at the mouth and see how that looks. Okay, we're gonna put some gloves on for the inspection. Okay, can you open your mouth? Good. Okay. You take your tongue out, side to side. Okay, I'm gonna look around your cheeks, around your teeth, make sure they're good. No teeth are missing. It's symmetry under your tongue. Okay. Okay. And that looks good. Okay, next we're gonna see the jaw and TMJ. Hold on close. Alright, can you protrude your jaw forward? Side to side. Alright, that looks okay. Next, we're gonna go ahead and palpate the lymph nodes in the neck, and we're gonna check the carotid. So we're gonna start with the ones under the chin, move down. The ones behind the neck. Okay, we're gonna check the carotids. Found them there. Also gonna listen to them with the bell. Hold it. And over here, we're just gonna go ahead and feel for the lymph nodes above the clavicles. Alright. We're gonna go ahead and check the cranial nerves here. We already did the tongue. We're gonna check for cranial nerve number 1. Would you be able to close your eyes? And I'm gonna bring something up to your nose, and you tell me if you can smell it, and if you know what it is, you let me know. Close one nostril. With one hand. Yeah, correct. Now the other one. Do you smell it equally? Okay, you can open up your eyes now. So we did that. Now we're gonna test the shoulders. Push out. Okay, put your hands in my hand. Shoulder. Alright, side to side. Alright. Those are good and intact. Alright. Listen to that. Go ahead. Yeah, okay, we're gonna check the thyroid now. If you can turn this way. Well, go ahead and check the thyroid here. Thyroid. Can you swallow? Alright. So we're feeling the thyroid for any edges or smoothness of it, and his was good. So next we're just gonna go ahead and move down to the extremities, the hands and the arms. We're looking for symmetry, which he has symmetry there. We're gonna come and check his pulses, equal pulses. Check his cat refill. Cat refill is brisk, less than 2 seconds. Can you test your fingertips? Alright, that's good. Alright, now we're gonna check Allen's test. So we're gonna occlude the ulnar and the radial artery. You can close your fist a couple times, quickly. Alright, now we're gonna release the ulnar first. Open it. Watch it come back, and then release the radial. And that was intact, and that was good. Circulation and reperfusion there. Next, we're gonna check for sensation. All right, you can just stand your arms out and close your eyes, and you just tell me if you feel it sharp or dull. Okay, and that was good. Sensation was intact. Next, we're gonna check the Phelan's test. Okay, if you can hold your hands like this, and you any tingling, numbness, or any sensation, we would usually have him hold it for a full minute and see if any of those signs or symptoms are showing up. But he's okay. We're not gonna have him hold it for a full minute. Next, we're gonna go ahead and have him turn to his left, and we're gonna go ahead and look and inspect the back and listen. All right. All right, here. We're gonna pull up your shirt. Is that okay?
Yes.
All right. So here we're inspecting. We're looking for symmetry, any abnormalities. We're gonna look for scoliosis. Now, when we palpate the spine, we're looking for lordosis or kyphosis in the back. And first, we're gonna go ahead and palpate here. And you tell me if you feel any tenderness. No? Okay. We're gonna go ahead and run our hand down the spine. And the spine is in line. Okay. We're gonna go ahead and have him say 9-9 after whenever put my hands on it so we can check for fremitus. Say 9-9. 9-9. 9-9. 9-9. Okay. There's no fremitus present. Alright, we're gonna go ahead and listen to his lung fields. Okay, and his lungs were clear bilaterally. Alright, next we're gonna have him breathe in and holding his breath, and we're gonna percuss to see where his lungs end whenever for lung expansion. Okay, so breathe in. Okay, now breathe out and hold when you breathe out again. Okay, so we would mark those spots whenever he breathes in, and we would mark the spot where we felt it at the bottom, and then when he exhales, we would also mark the spot and check the lung expansion on that. We did that. We're gonna check for CVA or any tenderness. So we're gonna just tell me if you feel it tender. So no tenderness on the costal vertebral angle. Um, Now let's see here. We listen to the lungs. We watch chest expansion, palpated the chest, the lung expansion. Okay, now we're going to let me see if I can remember. We're gonna go ahead and try to feel his axillary nodes here. That's where he here with the shirt up on this side. So we're gonna ask him to lift up his arm, come under his arm here, and we're gonna push in here and slide side to side in here. Feel for any enlarged nodes of any sort here, and he's okay. No nodes are enlarged in that aspect. Now we're gonna ask him to turn back around, and we're gonna listen to his chest. I'm gonna look at his chest and inspect it. Okay. We would also do the same and do the 9-9 checking for fragmentus and all that. Okay, we're gonna listen to the lungs first. We're gonna go under the shirt. Now we're gonna go ahead and listen to the 5 heart positions. Alright, we listen to the 5 heart positions. They sound good, regular heart rhythm. No signs of any prolapse or any other abnormal heart sounds. Okay, next we're gonna go ahead and let's see where we're at. Listen to the heart and lungs. Look at axillary nodes. Look at the chest expansion. Okay. Now we're just gonna have them lay down, and we're gonna go ahead and look at the abdomen and listen to the abdomen. So we can just lay down. Okay. So we're gonna lift up the shirt here, and we're gonna go ahead and just inspect initially, and look at the abdomen for any abnormalities, any pulsating masses possibly. Okay. And then we're gonna go ahead and listen first. The bowels are active. Then we would also, with the bell, the stethoscope, we would listen to the vascular sounds. Okay. No bruise were heard there. Alright. Right now we're gonna go ahead and palpate, see if we can find the liver here. Alright. Take a deep breath in. And breathe out. Right. Find the borders of the liver here. You can feel it there. And we're gonna go ahead and palpate the rest of the abdomen. And then coming up to the spleen. First you wanna percuss here for the spleen before we start pushing on it, just in case it is enlarged. Alright. And the spleen here is non-palpable, which is a good sign. It shows that it is not enlarged. Alright. Those vital signs were active. Liver, we found the liver borders there. Look for the spleen, and that was not enlarged upon palpation. Next, we're gonna find the femoral arteries. Okay. And they are there. We can feel them. Good strong pulses. All right. Next, we're gonna go ahead and move down to the lower extremities. We're gonna try to feel for the popliteal pulse, which is sometimes difficult to feel though. We're also looking for symmetry on the legs, any lesions, abrasions, any other skin abnormalities, but none are present. So we're going to go ahead and find the dorsal. And we can find those bilaterally. Next, we're going to go to the post-tib. And that one can be felt there. And while we're here, we're going to go ahead and ask him to pull or push against my hands. Alright. Neural checks with that. We're going to check cat refill. And we're also going to do the dull and sharp sensation to make sure that's intact in the lower extremities also. So if you can just tell me whenever you feel dull or sharp. Okay, and those are good. Okay, check the femorities, check neural checks on the legs. Everything looks intact and pulses are good and strong. Extremities are equal bilaterally. Alright, if we're going to ask you just to sit up on the edge of the bed now. On this side. Alright. Squeeze my fingers. Alright. The grip is equal and strong bilaterally. Now you can just go like this. Pull. Resist. Clean out teeth. Down. Up. Alright. Those are good. Next we're going to go ahead and go for the reflexes here. Alright, we're going to start with the brachioradialis. You can just relax there. Alright. Slight movement there. And there too. Now we're going to go ahead and go for the bicep. Alright. We got some there. Now I'm just going to ask them to relax on my arm there. I'll hold them up. And we're going to come here. We see a slight jump there. Not much, but we can see something. Alright, next we're going to go ahead and do the lower extremity. reflexes, okay? And that jump. Gotta jump there too. Now we're gonna check the Achilles reflex. You can see it there. Line. Slight there. And we got one there. Alright. Next we're gonna ask him to do a heel to his shin and rub it up and down the shin. So like there, like that. Alright, now the next leg. With your heel. There you go. That works. Alright. So that's intact. Those neuro checks are good. We're also gonna do a Babinski. Make sure his toes don't curl. Maybe tickle but not curl. Alright. And that's good. Alright. Lastly, we're gonna check his range of motion here. If you can stand up. And maybe the camera won't be able to catch it, but I'll be watching. Walk in a straight line, heel to toe. Good balance. Now we're going to watch the turnaround here. And back. On the balls of your feet. Now. And that's good. Well balanced, good gait. Posture as well. And good. Next we're going to do the Romberg and Palmer drift. If you can stand with your eyes closed and hold your palms with your arms straight out and up. Okay, we're watching for drifting of the palms, and we kind of want to stand just in case and spot them. But good balance, not drifting. I mean, slightly, but that's normal. All right, that's good. You can sit down now. Now look, we're coming to the end here. We're just making sure that we kind of covered everything. I'm gonna go through it. My checklist here. That. Alright, I think we've covered pretty much everything. And so that is the end of it.